of the causes of bleeding in early pregnancy. Implantation bleeding basically means spotting, and it happens when the developing embryo moves from the fallopian tube into the uterus to implant or attach itself into the walls of the uterus. Fertilization takes place in the fallopian tube, specifically in the ampulla. And so, after fertilization, the developing embryo has to move, or developed egg has to move from the fallopian tube into the uterus. So, whilst it moves and tries to implant itself into the walls of the uterus for pregnancy to advance, it causes pressure on the walls. You know, during pregnancy, there, there is high level of blood supply in the uterus. The uterus prepares itself very well for pregnancy. And so because of that, there will be bleeding because of the pressure. And in implantation bleeding, it doesn't take long, and the duration is about few hours to 2 days. It is done, it ceases. And so if it persists, it means there is something else coming up, and so you have to be alert. And doesn't it is harmless. Implantation bleeding is harmless. It happens to most women. The blood is mild and very light, dark brown, sometimes brown or pink. It doesn't cause any pain. And so if there is pain, so much pain, and the blood is heavy, then it might be miscarriage. Implantation bleeding mostly happens the 10th to 14th day after fertilization. Yeah, and so if you don't take care, you might mistaken it as light menstruations. Sexually transmitted infections cause bleeding in early pregnancy, like the gonorrhea, syphilis, chlamydia, and other sexually transmitted infections, and alarmed. Ectopic pregnancy basically means pregnancy outside the uterus. It can be in the fallopian tube or in the abdominal cavity. During my first submission, I told you that fertilization takes place in the fallopian tube, specifically in the ampulla. And so, whilst fertilization takes place, the developing embryo is developing. It has to move from the fallopian tube into the uterus for pregnancy to continue. And so, if it refuses to move and stick in the fallopian tube to grow, the fallopian tube cannot accommodate the developing embryo, and so it starts to expand. So while the fallopian tube expands, it causes pressure, and that brings about the bleeding. It expands and there will be blood. And so you have to be curious to know what is causing the bleeding. I know that is why you are here. And if care is not taken in ectopic pregnancy, it can rupture, and that is serious and emergency. And I don't want that to happen to you. So please, hormonal changes. During pregnancy, there is high level of progesterone and estrogen. Progesterone is very high during pregnancy, and you know it's female hormones. The estrogen and the progesterone are female hormones, and in pregnancy they help, especially the progesterone. So it becomes so high, and sometimes due to hormonal changes, there might be bleeding. That is why it is necessary to know what is causing your bleeding. If it's hormonal changes, you are good to go. If it's implantation bleeding, you are good to go. But if it is infection or ectopic pregnancy or molar pregnancy, then you have to be a little bit alarmed, and then it will be managed for you to have a safe delivery. Miscarriage happens before 20th week of pregnancy, and when it starts, there are types of miscarriage. When it starts, it sometimes starts with light bleeding with mouth cramps and pain. And then as time goes on, it starts to advance with heavy bleeding, and then with low abdominal cramps and pain here and there, and sometimes you start seeing clots. Is it safe to have sex during pregnancy? Yeah, it's safe, but how it will be done and the sex position, and sometimes if there is any underlying condition, you have to think twice. Vigorous sexual intercourse can cause bleeding and can even cause miscarriage. And so, if there is no underlying condition and then the gestation or the pregnancy is like the second month or third month, sex is safe depending on the sex position, depending on how vigorous or intense it may be. And so, if you want to have sexual intercourse, please let it be slow and adapt a suitable position for that so that it will not cause bleeding. Cervical erosion or changes. That is also one of the causes. You know, cervix is part of the uterus, it is the neck of the uterus, and it plays a major role during pregnancy and labor. And you know, it also prepares itself for pregnancy. It prepares itself for pregnancy. There is high level of blood supply. The cervix becomes so softer and vascular. And because of it becoming softer and more vascular, it's changing. There can be bleeding. And so that is why I'm saying that know what is causing your bleeding. As soon as you see blood in early pregnancy, it's no. So you have to know what is causing your bleeding and to be intervened as soon as possible. Thanks for watching this video once again. I'm Midwife Rahel. I'll see you soon. Thank you.